Thank you so much to the Massachusetts Health Policy Forum for including me in today's program. I'm so sorry I can't be with you in person. Today is the last day of the current legislative session, one that started on January 2nd of 2019. It was a whole different world back then, of course, pre-pandemic. It seems like a very long time ago. While I would have loved being among people who care deeply about public health, I can at least start by thanking you for your service. Over the next 30 minutes or so, I'll talk about my work in the 191st session, which, as I said, ends today. I'll talk about my efforts as Senate Chair of the Joint Committee on Public Health, the COVID-19 Task Force, the Racial Justice Task Force, and where I believe my team and I are headed into this next session, which starts tomorrow. If I could have done this live, I really would have loved your questions. Instead, I've asked my legislative director, Brian Rossman, to lead a discussion. Some of you may have been in the breakout session Brian just participated in. He has a long background in Massachusetts health policy. I learn from Brian every day. Before joining the Senate, I had never served in political office. Most of my professional career has been spent as an advocate on the outside of government, believing as I do that government works better if people make it work. I believed that before entering the State House to serve. Now, 2 years in, I feel it true in my bones. I served 24 cities and towns arrayed along the Connecticut River in Western Massachusetts, from Northampton, where I am right now in the South, climbing up the Connecticut River to the Vermont and New Hampshire borders. I think of my district as having some of the most beautiful natural landscapes in the nation. In my first term, I was honored to be named Senate Chair of the Public Health Committee, thinking that it was an important body of work, being delighted to lead it, but having no idea of how important it was to become during the pandemic. Over the last 2 years, the committee considered and reported on 458 bills, among the most of any committee. Public health, as you well know, covers a vast subject area. So did the bills before our committee. We covered a range of topics from A to Z, well, actually A to Y, acupuncture detoxification specialists to youth concussions. Every bill, as you also likely know, gets an open public hearing, typically 15 to 25 bills at each hearing, sometimes huge crowds, sometimes just the sponsor. I treasured those hearings. It's one thing to read the bill language, bill summary, maybe a fact sheet, maybe do a bit of research. It's quite another thing altogether to see the legislation come alive, to hear from people who inspired the legislation, to hear from staunch opponents. There are so many memorable moments. One such hearing was on a bill called Laura's Law, which simply and poignantly called for visible signage outside of emergency room departments in honor of a woman, Laura, who needed care and showed up outside an ER only to ring the wrong buzzer, likely pound on the wrong door, before dying on the sidewalk outside the hospital. We heard wrenching testimony from Laura's husband during the hearing. We passed it favorably out of our committee, and it passed the Senate as it should have. May it someday become law and prevent any more wrenching and needless deaths. As poignant and almost still in its grief as that hearing was, the hearing on vaccines and death with dignity, which is of course physician-assisted suicide, were not. These were packed hearings with hundreds of people with enormous beliefs and feelings on the issues, on multiple sides of the issues, hell-bent on testifying. Both of these committee hearings went on for hours, about 12 hours, and it was my job to keep them safe, accessible, productive, moving forward. In the end, our committee held 20 hearings. 4 of them starting in May were virtual, either written or video testimony. Every bill must get a response from the committee. We either approve with amendments, or hold a bill for further study. Let me say now that a committee's effort to study a bill generally means that the bill is dead for the session. It's not a euphemism I like to use. All in all, we approved in one form or another 187 bills. Some bills approved from the committee have passed into law. For example, the strongest in the nation flavored vaping ban and a menthol cigarette ban. A bill called SAFE, S-A-P-H-E, state action for public health excellence. That's the first SAFE. I'll talk about the second SAFE in just a moment. A ban on cancer-causing flame retardant chemicals used in bedding, furniture, and children's clothing. Expanding dental care benefits for adults on mass health, which we passed over the governor's veto. Revamping our system for mosquito control to address a disease called EEE, and I could name others. So it's been a very productive committee for the legislature. I'm also absolutely delighted that the Patients First Act, which the governor signed last week, incorporated many bills from our committee, most notably what we call scope of practice bills, which allow clinicians to work at the top of their license. That means they do all the things that they were trained to do. We've lagged behind on these bills in the state, much to our detriment. We also held several oversight hearings, which is of course a key role for any committee. The first was on food security as a public health imperative, or food as medicine. As chair of public health and as co-chair of the legislature's Food Systems Caucus, I wanted to draw a bright line between food and nutrition, food and health. The second looked at a particular challenges and opportunities embodied in rural public health. We held both of those hearings in Western Massachusetts in my attempt and my team's attempt to pull Boston west so they could really see life in our part of the state. We also decided to hold a hearing on the state's preparedness for the coronavirus, and we held that on March 4th. We felt that it was our job to help make sure that the state was prepared for the virus, that we were all tuned in, because the virus at that point, of course, was tearing its way across Europe and had already made it to the United States. What we heard was alarming, and it helped position the Senate to be strong advocates for our people and to look to build even stronger relationships with our colleagues at DPH. Later in the pandemic, we held a joint hearing with Healthcare Finance on the COVID-19 reopening. About a week after our March coronavirus oversight hearing, the Senate President appointed me to chair the Senate's COVID-19 task force. The task force started meeting daily, feeling the urgency of this moment, calling questions from senators and Senate staff, dividing those questions into issue areas, which we then tackled by pooling office resources. We ran the task force like an organizing hub. The task force was the hub and the subcommittees were the spokes. They were the center, the task force members, and we pulled in almost all Senate offices via the subcommittee, which produced bill after bill after bill very, very quickly on housing, eviction protection, and expansion of unemployment benefits, creating a COVID-19 racial equity task force, expanding mail-in voting, and many, many more. Perhaps the most stark truism that surfaced during our work and during COVID is that it affected our Commonwealth inequitably. I've said this many times, as have others. COVID simply and brutally laid bare the chasms created by racism and poverty that existed long before the pandemic. During COVID, we learned again and again, painfully and brutally, that racism is a public health issue. As we emerge from COVID, we must acknowledge that in part because of aching health disparities and disproportionate rates of pre-existing conditions, in part because of the debilitating and compounding effects of environmental racism, communities of color have been much harder hit by the virus. That biting truth, together with the brutal murder of George Floyd, led the Senate President to convene the Senate's Racial Justice Advisory Group. She convened us for a marathon as well as a sprint, which was embodied in the landmark police reform legislation passed by both branches and signed by the governor last week. I was honored to be appointed to that task force as well. My team's particular contribution were provisions providing for non-police crisis response in an emergency when social work or behavioral health response is much more appropriate. As I speak to you now, my team is buzzing with work for the next session, which again, of course, is tomorrow. Among other priorities for next year, so many of them based on this year include health equity, the need to integrate racial health equity in all levels of government, in all agencies, and this one must come from the top down. We're talking about PFAS. PFAS is a toxic chemical found in all sorts of products. We're thinking of how to ban PFAS, take it out of food containers, carpet treatments, pesticides, bottled water, and more. And of course, local public health. We have not built up our local public health system, and now COVID has shown the dangers. In Massachusetts, it's particularly troubling because we have 351 local departments and boards of health, the most of any state. We need to set up standards and provide sufficient funding. That's why, again, I'll join with House colleagues Denise Garlick and Hannah Kane to introduce State Action for Local Public Health Excellence, or SAFE 2.0, a bill that would accelerate equity and effectiveness of our local and regional public health systems. In the March 2020, the March 5th, 2020 COVID-19 oversight hearing I convened, which I talked about earlier, Lisa White of the Cooperative Public Health Service of Franklin Regional Council of Governments testified that her ability to protect the public was limited by having just one full-time public health nurse herself for 14 communities. That's what's happening out in my neck of the Commonwealth. Then in a June reopening hearing focused on public health and healthcare, speaker after speaker discussed the structural deficiencies and glaring local public health gaps wrenched open during COVID-19. Gaps and deficiencies that demanded a more comprehensive approach. At the same time, local public health officials in our region made it clear, and they continue to make this clear to me every day, that our current path is completely unsustainable. And this as we enter this next surge in the virus. The goal of SAFE 2.0 is to build a more equitable system that will also provide essential public health protections to all Massachusetts residents. And we'll do it these ways. The first, ensuring that every resident has access to a core set of public health protections understood at the state level, establishing minimum public health standards for every community, increasing the capacity of our local public health colleagues, creating a uniform data collection and reporting system, and providing, again, adequate and equitable state funding. Faced with the inequities laid bare by this pandemic, we must seize this opportunity to make these changes at the local public health level that local public health officials have been demanding for years. It's a moral response to COVID-19 and the pandemic's grave impact. In closing, I'll just say that I remembered that the origins of the word government can be found in the Greek and Latin words that aptly mean to steer. While we address the wrenching pain and turbulence of this time, we also, all of us, must steer our region and our Commonwealth into calmer waters, but not back to the status quo. People ask me all the time, when will we get back to normal? And I often reply, I don't want to get back to normal. Normal wasn't nearly good enough. I want to move forward toward something better, to build back better toward equity. Much better for our public health infrastructure, much better for small businesses and workers, much better for students and teachers, much better for all of those who have lived too long on the margins of the Commonwealth and who now and finally need justice. Thank you again for inviting me. Thank you for your work and service. I wish you well as your conference continues.